Do you remember the moment you realized that you had wrinkles? Then came those moles and you couldn't play it off as a beauty mark. And right after that, the smile lines were there, even when you weren't smiling. All right, Ethel Batson has seen it all and wants it all gone. So she went to see Dr. Richard LeConey and Dana LeConey at the Institute of Anti-Aging. They're here with us this morning. Good morning. All right, Ethel, a lot of us say, hey, we're okay like we are, but what was the point where you said enough already?
When the large moles start coming in, you know.
When the what now?
The large mole.
The large mole
yeah.
started coming in?
Yeah.
All right, a lot of people have those, they call them moles or tags, but Richard, what are those? How is that caused?
Well, you know, there's a number of things that she has. She has a few different things. They all have darkly pigmented appearance, but some are moles, some are skin tags, some are things called seborrheic keratosis, but they all have the same general appearance, and we can treat them a little bit differently. Some we treat with the hyfricator, which Dana is holding in her hand right now. This is a real simple device. It can just dry out the mole using a little electric current. It has a little mild, you know, tingling sensation.
Yeah, and I oftentimes see this on dark skin in particular. Right,
yes, it's very common, and it's genetic. And some people have a number of them. It's best if you start early, you can kind of catch them as they come. The nice thing is that this technology is not really expensive, so we could just spend the time and, you know, and just work them over. Sometimes if someone has a lot of them, we'll do, you know, we'll do a half an hour, an hour's worth, and then come back and get the rest. But we can get to them all.
Yeah, well, I just got two.
We're gonna go for it.
You're gonna go for it? Okay, we might have to do that. Okay, we might have to do that.
Seconds.
All right, yeah. All right. The other thing that she was talking about, something I hear women complain about all the time, and that's when you start to get that depression underneath the eyes, and sometimes it causes your eyes to be dark underneath because I guess you see blood vessels through there because it's a
number of
thinner
different
tissue.
Causes, names for it. Some people call them tear troughs, just dark circles. It's caused by a loss of volume in the tissue right here, just like we experience loss of volume everywhere in our face. And I've always said it's kind of like a balloon. If you let a little bit of the air out, the balloon becomes kind of floppy and sags a little bit. So that's really one of the reasons for sag, is that you've lost a little volume and now your skin doesn't have the turgidity or plumpness that it has. So then it kind of does hang down a little bit and it exposes that area. All you got to do is plump it back up.
And years past, I know that people have gone in and said, what do I do? And the best answer they got was use some concealer. But, you know, we want to look as natural as we can and act like it was never there.
That's the low-tech
the low-tech, the low-tech $1.99 is the concealer. But, and when we come back a little bit later, we're going to talk about some of the prices involved with this. But, so now you're able to do that. And that also, we've been told with that thin tissue that it's very sensitive, that you didn't want to do anything there. But this is not a problem, obviously.
Well, you know, it is thin area, so you have to be careful about how much you put in, because you overfill it, then you look like you got a bag under your eye. So you traded a hollow for a bag. Neither one of those are too good. So it's a technique. It's a technique that has to be done just right.
Okay. The other thing that she was talking about is something that a lot of people talk about, and that is, we call it the nasolabial, but the term that most of us say is the smile lines.
Smile line.
Yeah, that are there when you're not smiling. Stop that, right?
Exactly. And use the same thing. Use a little dermal filler there to restore the volume back to the skin. Again, it's caused by loss of volume and a little bit of a sag of the tissue. So.
What is that stuff made of?
It's made of hyaluronate, which is the same stuff that your skin has in it. It's the natural intercellular filling substance.
And the good point with that is that your body's not going to reject that?
It's virtually unheard of, any kind of allergic reaction to hyaluronate.
So this is not permanent, is it?
No, it's not. Depending on where you put it and how much motion is in the area, because that's what breaks it down, you could get anywhere from 4 up to even 8 months out of it.
Okay. What about the moles that she's having removed? Are those moles going to come back?
You know, she'll get new ones, because it is genetic and it does occur more frequently with age. So people that form these will constantly, you know, create new ones. And so the thing to do is go ahead and get them all treated, and then just kind of treat the new ones as they come. You know, every 6 months to a year, go in and get the new ones zapped.
Yeah. And the nice thing is it doesn't hurt. I mean, it just takes about 30 minutes, they'll all be gone. They'll dry up in a few days and flake off, and it's going to probably cost her around $150 to $300.
To remove all those? Okay, so let's go ahead and start on the eyes and show us what you're going to do there.
Okay.
Let me take that. I'm going to use it myself.
All right.
Anybody else? Anybody?
Hold still.
Okay.
So we're going to plump this area up.
And you mentioned earlier that you had done just a little bit of numbing cream. So, and let me ask you, Ethel, does it hurt?
No.
When you were feeling the moles, did you feel anything at all?
No, no.
She's kind of numb because I just gave her a dental block. So.
Oh, okay, okay. You know, the cool thing about this is what I have noticed, and this might be just me, is that when you're getting something done for vanity's sake, it never hurts. Okay? If this was to save her life, she'd be jumping out of the chair going, I can't do it, I can't do it.
Or at least you're not going to admit it.
Yeah. Okay, so we can see that you're filling in there.
That.
You can see that immediately.
Amazing.
Wow.
It just dries up the mold. She's doing the filler now.
Yeah, and you're not feeling anything at all, really?
No, I'm more nervous being on the show.
She's more nervous. We're more painful for her being on the show live than her getting this done.
Right here a little.
So this is one of those things that you could literally go in on a lunch break and return looking fresh and new, and no one will know what happened there.
I mean, the filler, you see a little bit of redness at the point of injection, but other than that, there's really no downtime to this. On the rare occasion around the eyes, a little blood vessel could cause a little, what I call BB-sized bruise.
Yeah, that's when you break out the concealer again.
Exactly.
Yeah. Ethel, I know why it doesn't hurt, because you just had back surgery, so this is nothing compared to that.
See, now look at that, how it just pops it out.
Yeah. It's just getting rid of that line there, which again brings back the look of youth. Why did you decide to do this? You had the back surgery, and then you just said, look, you looked in the mirror and you just said, look, I want to turn a new leaf, I want to do new things.
Yes, I'm actually trying to get back into work, so I just want to have a fresh look.
Yeah, just give you some confidence when you walk back to the workplace. Yeah. All right, guys, we'll take a look at Ethel's picture before, okay, which is kind of like this, but the picture before, there you go. As before we start the process to fix her flaws, stay with us because in about 2 minutes, you'll see how the LeConeys are taking years off her face.